heard of a herniated disc, but for today's Health in Focus, we're going to explore what exactly that is, because I guess I really didn't know. So we're going to the expert, board-certified neurosurgeon, Dr. Jay Jaganathan, to talk about, so what is it? What happens when a disc is herniated?
So a disc is the material that's in between the vertebrae of the spine. It's usually composed of fluid that's surrounded by some tissue, fibrous tissue, that allows the spine to keep its flexibility. And in some cases related to abnormal movements, related to smoking, and to other factors, the covering around the disc can get weak and the disc can herniate outwards. So in a situation like that, normally the discs are contained within the fibrous layer called annulus, and in some cases they can herniate outwards and cause pressure on the nerve, which is what you're seeing in the diagram below.
Okay. And so what are the typical treatments for that?
Typically we start with conservative treatments, meaning non-surgical treatments. That's going to be things like bed rest, analgesics, medications to control pain. Physical therapy plays an important role, and lifestyle modifications such as weight loss, stopping smoking cessation are important factors as well. There are studies that have shown that a disc herniation can improve with time if it's treated conservatively, but obviously during that period of time, patients oftentimes have pain, and it's important to control the pain during that period when the disc is healing. And if that doesn't work, then we go into surgical treatments, which would involve going in and taking out the disc that's herniated.
Okay. And so for a patient, the symptoms are just essentially pain, is that it, or other things?
Typically, the classic symptoms we see is pain and presentation. In really severe cases, it can cause weakness. Usually weakness is a sign of a medical emergency, meaning that it's got to be addressed, because even with successful surgery, weakness is not guaranteed to improve. And finally, again, in extremely severe cases, the nerves that control the bowel and bladder function can get affected, and in those kind of cases, patients can oftentimes complain of incontinence or numbness in the genital areas. And again, those are generally signs of fairly advanced discs, and those are discs that need to be treated fairly emergently in most cases.
And how often are the less invasive procedures effective in treating the pain and getting people back on their feet?
Sure. The vast majority of discs are treated non-invasively or without surgery, so that's going to be with things like physical therapy and pain management. The minority of cases where those don't work, or in cases like we discussed where there is neurologic deficit or severe symptoms that aren't getting better, surgery is usually required. The important thing to note is nowadays we do have minimally invasive approaches with surgery, where we can go in with using a microscopic technique with an incision of about 2 centimeters to go in and remove the disc, or more commonly now with what's called the endoscope, which is a camera that you can go in and remove the disc with an incision the size of just a few millimeters. So there are some very minimally invasive surgical techniques as well, but the majority of patients are treated non-surgically in the beginning at least.
Okay. All right. Thank you so much. So if you want to learn any more about this, you can always head to our website. Thank you so much, Dr. J. Just go to 9in10news.com.
This Health in Focus is a paid segment by Jaganathan Neurosurgery.